is an individual, is a family, is a mother, is a father, is a sister, is a brother.
With most of the nation under stay-at-home orders, the CDC experts say they're seeing a disturbing trend among African Americans, a group showing higher rates of serious complications
from the virus. People of color are facing alarming rates of infection. In Chicago, 68% of the city's deaths involve African Americans, who make up just 30% of the population.
Those numbers take your breath away.
In Louisiana, 70% of those who have died are also African American, though they too comprise roughly 30% of the state's population.
Number one, people unfortunately are more likely to be of low socioeconomic status, which makes it harder to social distance. Number two, we know that blacks are more likely to have diabetes, heart disease, lung disease, and I and many black Americans are at higher risk for COVID. It's why we need everyone to do their part to slow the spread.
It's the U.S. Surgeon General just this morning talking about the heightened coronavirus risk for African Americans. Some states have released the racial breakdown of cases and deaths, and those numbers show a disturbing trend, a disproportionate number of African Americans being infected with coronavirus and dying. Joining me to share their expertise in their reporting, Dr. Kamara Jones, the former president of the American Public Health Association, Politico's Laura Barone-Lopez, and CNN's Van Jones. Doctor, I want to start with you, and I've just put up some numbers. I'll get deeper into them in a moment, but just these side-by-sides. Illinois, African Americans make up 15% of the population. They are 42% of the state's coronavirus deaths. In Louisiana, African Americans make up about a third of the population. 7 in 10 of the deaths in Louisiana are African Americans. In Michigan, it's about 14% of the statewide population. More than 40% of the deaths in Michigan from COVID-19 in the African American community. It's a combination of things, I'm sure. Some it's the urban density, some is the disparity in the healthcare systems. What is your biggest takeaway on why this is happening and what can be done?
So, first of all, we have to be clear that in December 2019, none of us was immune, right? So all of us should have an equal opportunity of being infected. But what this virus has done is taken away the mask, the veneer, pulled the sheets off of this myth of equal opportunity in this society. So what is happening is that black folks are getting infected more because they're exposed more. And once infected, they're dying more because their bodies, our bodies, have borne the burden of chronic disinvestment, active neglect in our community. So when I look at it, it is because of structural racism, which puts us in the more forward-facing jobs so that we're more exposed and less valued, don't even have the protection that we need. And this chronic, the residential segregation that turns into employment segregation, educational segregation, environmental hazard segregation, all of those insults in our bodies have given us more of these so-called pre-existing conditions. So once we're infected, we have more severe outcomes from the disease.
I want you to listen, Van, I want to come to you next, but I want you to listen to the governor of Louisiana, who's looking at these numbers and says, as Dr. Jones just said, this is a horrible thing and we better learn about it as soon as we can.
Right now, slightly more than 70% of all of our deaths are among African Americans, who make up about 32% or so of the overall population of our state. So obviously this is a big disparity, and we're going to try to figure out what that is attributable to and what we can do about that as quickly as possible.
And Van, as you come in, I just want to put the numbers, just Louisiana numbers up side by side, because people need to look at the numbers and let them sink in when you look at it. 33% of the population of the state of Louisiana is African American. 7 in 10 of the deaths in the state of Louisiana are among African Americans. That's just a more than double your proportion of the population. When you hear the governor there, Van, I take him at his word that he is very well intended. You also know the history here. We have a crisis, everybody ramps up, a lot of money gets spent, and then some of the disparities that may have been a major factor in contributing to the crisis, when they're over, they either get forgotten, put aside, or there's not enough resources to deal with them.
Look, I was in conversation with the governor yesterday. I know that he is well intentioned, but here's the reality. We got off on the wrong foot here from a media point of view and from a community point of view. Everybody started saying in the black community, this is a white folks thing. You're hearing about white folks in nursing homes. You're hearing about white folks who went to China. And in fact, a rumor got started that black people were literally immune to this disease. That was all over the internet. Started off as a joke. People took it seriously. And in fact, you've seen this before with HIV. Oh, HIV, that's just for gay people. I don't have to worry about it. And then it spread everywhere. This is a disease. The numbers for the black community are going to be completely different than the numbers coming out of China or Italy, because it's an epidemic jumping on top of a bunch of other epidemics already in the black community. We already have an epidemic of high blood pressure, which is lethal if you get this disease. Nobody's saying that. We already have an epidemic of asthma, obesity, etc. In other words, you got to start saying to your black relatives, your black friends, do you take pills every day? If you take pills every day, are you supposed to? Get your butt in the house and don't come out, because you are going to die. Well, I'm not 80 years old. I don't know. It's not just age. In our community, it's going to be, are you sick? And black people are underinsured, underemployed, and barely healthy on a good day because of things that were just mentioned. We have to change the discussion. We can't say comorbidities. That doesn't mean anything to the people who are in harm's way. The people who are in harm's way, do you take pills every day? Do you got sugar, diabetes? Do you got pressure, high blood pressure, hypertension? You could die in a week. You cannot be here. You've got to start screaming this to the black community, or you're going to have a catastrophe on your hands.
Agrees with Dr. Jones about where it's coming from.
Communities of color, and particularly black communities in the city of Chicago, suburban Cook County, and cities and towns all across our state, disproportionately shoulder the healthcare conditions that lead to worse outcomes with COVID-19. That's a product of generations of systemic disinvestment.
He talks about the generations. Laura, again, I want to show you the Illinois numbers, because I just think people need to understand, by looking at the numbers and understanding the disproportionality of this. 15% of the population of Illinois is African American, 29%, double the population essentially percentage in the cases, and then 42% of the deaths. You've been doing a lot of reporting on this issue. Everybody's in crisis mode right now, trying to protect their citizens, trying to get their hospital supply they need. Do the politicians get it for the long term, or will this fade when COVID is shoved aside by some?
Please limit the social gatherings, and like and subscribe and share, please.